what I love about this therapy is that there is no downside. It cannot make you feel worse. It can only make you feel better. So there's no negative side effect, which most things that we take, we're having to manage
Yep.
the benefit versus the downfall. And there really is not any of that in red light therapy. So it's pretty phenomenal.
Have you made it past menopause, or are you going through it now? I'm Dr. Pat McShane, and on the Women's Healthspan Voices podcast, I'll guide you through the health challenges of the menopausal years and beyond, guiding the way to thriving in this powerful era of your womanhood. I'm delighted to have a guest today who's been a pioneer locally in the use of light therapy, and I'm going to let Tess Peterson tell a lot about her own background and how she became the owner of a light therapy spa that I attend, full disclosure here. And we're going to explore some of the aspects of that will come into play for senior women. So, Tess, tell us a little bit about your background and how you came to own Light Lounge in Colorado.
Okay. Well, thank you, Pat. I appreciate being here. I have a varied background. In college, I did medical research and looked at the how brain injury and recovery was affected by anticonvulsant drugs. So I had a passion for medicine and kind of was going that direction. And I had a car accident, and the car accident led to 20 years of chronic pain. And that was continuing throughout 20 years. And about halfway through that, I had a autoimmune disease that I had had since I was a child that sort of just came back on the scene around 40 years old or so and was really giving me a hard time. So I was really pretty disabled in December of 2020. And that's when a friend introduced me to light therapy, to red light therapy. And I started going to a light lounge in Evergreen and had tremendous results, both in my autoimmune disease being either in remission or healed. It is not in my body. We've not seen it since. And the chronic pain that I had had from the car accident was also completely removed from me. So a complete change in my life in, in this 20 years. And I had tried every therapy there is and discovered how important and valuable red light therapy was. And that really was my motivation for opening up the Light Lounge in Arvada, is because I knew more people needed to have access to this. And so I opened one.
And I'm glad also for my own sake. We tend to think of it as sort of a newish therapy, but it's really not that new, and it's been around for a while. Maybe you could give us a little bit about the history and then the mechanism. How does it work for different diseases and symptoms?
Yeah, you're right. It has been around for a long time. It has been researched for over 60 years now. The government started looking at it first to heal battlefield wounds and found that those wounds healed 3 times faster. And that was kind of the start of research for its red light therapy. We use the term red light, but the true term is photobiomodulation, or PBM for short. And
That's a mouthful. Yeah.
it is. We can break it down, right? Photo, light, bio, life, modulation to change
Mhm.
effect. So that's how that is. But yes, PBM is much easier to say. And it has had now over 7,000 clinical studies with no negative side effects, which is pretty incredible.
And it's even FDA approved for cosmetic or aesthetic applications in the facial skin, is my understanding. Yeah.
It is. It is. It also has some other applications that are very interesting. Children fighting leukemia. It is a necessary treatment for them now. They get sores in their gastrointestinal tract from their mouth all the way through. And this therapy has helped them be able to eat and heal the sores that they get. So it is really
Mhm.
catching on, and they're finding that there are so many uses for it.
Maybe you could give us an example in your own spa, your own studio, of a woman in the age group that we are discussing here who's had
Mhm.
some really, really important results from the treatments.
It's very exciting. I get to see it every day. in the studio,
Yeah.
having people come in. We even can get, perimenopausal symptoms in our late 30s, right? So sometimes I have people coming in feeling different aches and pains, or hip pain is a big one. I'm sleeping at night and my hips hurt. These are women in their late 30s, 40s, 50s, and they just toss and turn all night. The hips are hurting, the joints are hurting. Often they'll be sent to physical therapy or more exercises, and that's actually the wrong thing to do, because what's happening is as we get older, we have less ability to heal. Our tissues are just not healing the way that they used to. So we're getting the ligaments and muscles around our hip joints start to break down. And because we're not healing the way that we used to, that is what we're feeling when those hips hurt and when some of our joints hurt. So red light therapy takes women our age, where our mitochondria have really slowed down. We're not getting a lot of energy output out of our mitochondria. And these wavelengths of red and near infrared light stimulate the mitochondria to have a huge energy production. The ATP goes wild and our body starts healing. So we're really regenerating tissue over time. And I've seen such an impact of that, not only in this pain, like the hip pain, there's a lot of joint pain or just kind of random pain that seems to travel, is really helped by this therapy, as well as our glands that aren't maybe working like they used to. We're working on healing the glands, helping that hormone regulation, and yeah, really healing, being able to heal the tissue so we feel better. We're helping not just the physical, but the emotional and mental toll that that has on us as well.
Yes, absolutely, throughout our whole daily life. Tell us a little bit more about the actual apparatus and how often they need to come in and how long the treatments last and so on.
Yeah, that's a great question. So we use primarily full body pods. So we are going nude or almost nude inside of a machine that looks like a tanning bed, but it has no UV light. It is only red and near infrared. So we lay in there. Our machines are medical grade and therefore powerful. And we only need 15 minutes to really fill up our bodies with this light. You can think of it like each cell in our body is a well, and it will fill up with light and then at some point just pour out. It can't hurt us. There's no amount of it that's going to hurt us, but there's no additional benefit beyond about 15 minutes. So it's really good to fit into your life because it's not going to take a long time. So we recommend people do this 2 or 3 times a week or more. There's zero downside to going more. In fact, the more often you come in and stimulate that healing process, the more quickly people will feel the results and, feel better. So the more the better. So we have it really set up as an unlimited membership so that people can come as often as they want to. And I think this is a way to help people take control of their health, right? They get to
Hmm.
determine how often they come in. And if they feel great coming in every day, they get to come in every day. So that is our primary thing that we do. We also have a handheld device, and myself and another employee are certified laser therapists, and we can treat smaller areas if there's, like I said, hips that are hurting, or back pain, or these kinds of things. I can treat that very directly, and the handheld is about 4 times the strength of a pod, so it's a quick, effective therapy. And then we also have other devices that we can sell, things that are not medical grade, more consumer grade, but things you can use at home. Red light pads, red light helmets, which are really effective for PTSD, Alzheimer's, Parkinson's, that kind of thing. We rent helmets to go home, and we sell the red light pads.
I know the initial application that became well used in the consumer market were handheld devices for facial healing or wrinkles
Yeah,
and facial
yeah,
tone. Yeah. And I personally used the handheld device. I didn't use it, what your technician did, when I recently fell and had a facial injury, and the healing was quite spectacularly quick. I was
yeah.
surprised. I was afraid to go anywhere for a while there, but I healed up pretty quickly with the localized therapy. Plus I was still using the pods, the beds as well. So Uh,
Yeah, the two go
yeah,
very well together.
yeah. And there are applications for eye diseases as well. I know you don't
Yeah.
specifically have that in your studio, but there are places where you can get red light therapy for your eyes. Could you tell us a little
And
more about that?
actually, yeah, it's exciting. I'm glad you brought that up because it affects a lot of women our age too, right? With the
Yep.
cataracts or macular degeneration, men too. I have seen recently in the last few weeks many people getting great results for those things. Healing of
Mm-hmm.
cataracts, someone had a cataract surgery and the doctors thought you're never going to be able to be without glasses. They are without glasses
Mm-hmm.
now. Macular degeneration, getting injections in the eyes, and now they don't need that anymore. So we are seeing amazing results for eyes.
But you would obviously recommend that somebody speak to their ophthalmologist and have a full medical evaluation before seeking
Absolutely.
this kind of treatment independently. That would be my recommendation in any case,
Of
and I
course.
presume it's yours. Yeah,
Yes,
yeah,
yes. Always talk to your
yeah,
doctor for sure. I think
yeah.
eye doctors, ophthalmologists are very excited right now because there has not been a new treatment for macular degeneration in, I think, 50 years. So they're pretty
Uh-huh.
excited about the red light. Other physicians, some don't know about it, but it is certainly always good to talk to your doctor.
Anything that I didn't ask you about that you said you could talk about this all day long? Maybe those were individual reactions that people had had that you know. Yeah.
Yes, yes. What I love about this therapy is that there is no downside. It cannot make you feel worse. It can only make you feel better. So there's no negative side effect, which most things that we take, we're having to manage
Yep.
the benefit versus the downfall. And there really is not any of that in red light therapy. So it's pretty phenomenal. And you're right. The term red light therapy is generally used for cosmetic that you mentioned a few minutes ago, and it is amazing for that. But also the beds that we use, this PBM, photobiomodulation, is also phenomenal for the skin. So we're seeing scarring go away, cellulite even, which is interesting. People are always very happy when that helps. um, yeah, so we're seeing all kinds of phenomenal things post-surgery, knee replacements, hip replacements, recovering from those things really quickly. So any kind of recovery, injury recovery, similar to yours, we're seeing great
Mhm.
results in seeing those things healed.
And are these spas or centers pretty widespread at this point around North America? Maybe that's not a fair question to ask you, but yeah.
So Light Lounge isn't everywhere yet. We're working on that, but we are really good at helping people find very similar red lights. With it's surging in popularity and people are learning more and more about it. And as that happens, it's very exciting that people are learning more about this. But with that come the scammers too. And so
Hmm.
people just need to be careful that they're comparing apples to apples, that we're not comparing, say, a red light therapy device with a photobiomodulation device. They're not the same. So I do a lot of help with people like finding a similar device, finding a similar spa that provides something similar to what we use. So I always love putting people in the right direction. We want to
Yeah.
find a reputable business that we can trust because there are some that are not.
Talking about the individual home-based units that you can buy, there's a pretty big bunch of information out there on
Mm,
the search engines about, home-based red light therapy units. But again, there's a wide variety of grades of machines and so on. They're pretty expensive and they
mm,
don't cover anywhere near the amount of your body that the pods or the beds cover. So I actually
yeah.
purchased one and then segued over to going to the spa, to the center 3 or 4 times a week. If you want to try it at home, I certainly would recommend doing that, especially if there's a small area of your body that's of concern. But if you're looking for more generalized wellness, I think the pods or the beds are going to be working better for you. Would you agree with that, Tess?
Yeah, they are certainly, because we have medical grade devices, which are going to be, just a level above, right? We're a class 3 device
Yep.
going potentially to a class 3B device. Most other units, you can get panels. A lot of people will buy panels at home from a reputable company, and those are good, but they're not going to give you the depth of benefits that a
Yep.
class 3 device will. But there are
Yep.
certainly a lot of benefits for them, cosmetic being
Yep.
one of the biggest ones.
Yeah. You can buy the beds for home use, but they cost about the same amount as an automobile, is my understanding so far. So
Yes,
most of us aren't
very
going to have
expensive.
that.
Yeah, very nice
Yeah.
automobile. Yeah.
Yeah.
Yeah, that's why I do a membership.
My membership is much less than leasing an automobile. So,
Yes, yes.
well, thank you so much. This has been fabulous information. I'm sure many of us have seen this in passing and just wondered or tried maybe a home device or a handheld cosmetic device and wondered whether it might be more applicable for other situations that we find ourselves in. So thank you so very much, and may you continue to do well with your center. Thanks.
Yeah, thank you very much, Pat. I really enjoyed talking to
Yeah.
you today and certainly love to help people get more information. So if there's any way that I can help get some good information to people, you let me know.
Okie dokie. Thank you so much.
You're welcome.
Thanks for listening to the Women's Healthspan Voices podcast. If today's episode spoke to you, follow the show and share it with a friend ready to take charge of her health. And please leave a review. It helps more women find us.